Hello and welcome to part 2 of Mumps, slides 15 through 19. MMR is a weakened live virus. This means after injection, the virus causes a harmless infection in the vaccinated person with very few, if any, symptoms before it is eliminated by the person's immune system. Mumps has two different types of vaccines. MMR2, which has a combination vaccine of measles, mumps, and rubella. And there is Proquad, which has a combination of measles, mumps, rubella, and varicella. The general cost for the vaccine is $21.70, which is affordable for most people. The way you get your vaccine is by 2 doses. By the first dose, it is 78% effective for mumps, and by the second dose, it is 88% effective for mumps. After you have had your second dose of the MMR vaccine, it'll last you the rest of your life. When you get the MMR vaccine, it is usually administered at 12 to 15 months of age, and then your second dose is at 4 to 6 years of age. The people who shouldn't get the vaccine are people who have had an allergic reaction after a previous dose of the MMR or the MMRV vaccine, have any severe life-threatening allergies, are pregnant, have a weakened immune system, or have a close family member with a history of hereditary or congestional immune system problems, has a condition that makes them bruise or bleed easily, has recently had a blood transfusion or received blood products, has TB, or has gotten any other vaccines in the past 4 weeks. The risks of taking the vaccine are sore arm from the shot, fever, mild rash, temporary pain, and stiffness in the joints. The benefits are that you are very unlikely to get mumps, measles, or rubella. So the risks of taking the vaccine is very minimal. In 1971, the U.S. government licensed the MMR vaccine. An article published that the vaccine induced immunity to measles in 96% of vaccinated children, mumps in 95%, and rubella in 94%. There are no new developments in the vaccine, but there is no need to because the vaccine is already very effective. And then the vaccine is widely available in most all developed countries, but there are still children and adults being affected by mumps in other third world countries. So there is still a lot of cases today. Anti-vaxxers are against the MMR vaccine because they believe that vaccines can get you sick or cause autism or won't actually work. They think that the risk outweighs the benefits, so they choose not to have the vaccine. But medically speaking, they are wrong It has no proven link from vaccines to autism. And while you may have some side effects from the vaccine, like the sore arm, fever, stiffness of joints, it's much safer taking the vaccine than it is not to. So medical practitioners should promote this vaccine. The argument that exists for making this vaccine mandatory was that in 2002, measles was declared eradicated, but in 2014, there were over 600 cases of it. If vaccinations for this disease is not widespread, it could all unvaccinated people at risk. And that's our works cited. Thank you. Have a good day.